My name is Elizabeth Dongo, and I am public health student here at Wayne's Eastern Washington University, and here to present a topic regarding mental health and suicide prevention in teenagers. And my objectives for this presentation is first to define what is mental health and suicide. Second is to look into the suicide rates in teenagers, and what are the risk factors and the warning signs that increases these mental health and suicide rates in our society. And the other thing that we're going to look into is the protective factors that would help us as a society reduce the mental health and suicide preventions, and increase the prevention and reduce the rates in our society. And then the last thing is to discuss is what are the available resources in our society for teenagers that would help us to prevent suicide rates. So mental health and suicide, it's mental health is actually psychological, emotional, social, and physical well-being. And it is how we think, how we feel, how we act, and how we make choices. And in looking into our teenagers, from CDC this as a resource, it shows that from 2007 till 2002, 2022, it shows this increase of the suicide rates among the teenagers between 15 and 19 years old, and 37% of them have reported they have experienced these episodes and persistence of feelings of sadness or hopelessness, and 19% have actually considered attempting suicide. 16% have made a suicide plan, and 9% of them had attempted suicide. So what are the risk factors that predispose our teenagers in our society to develop these plans? So one of them is having problems in schools, and or even peer pressures. And then the third thing could be moving in a new place, which is like either moving to a whole new community or moving with a new family member or friend, or even bringing in a new pet in the family. That could also being a risk factor. The other risk factors is mental health problems, substance use like alcohol and recreation use, drug use, parental divorce. That's a big impact in our society, in our teenagers, in our society. Having low self-image and low confidence, also that becomes a paramount issue. And the other thing also can be attributing to this factors and the suicide rates is having trauma, like previous trauma or even recent undergoing trauma. That also could attribute them to having increased suicide rates. So what are these warning signs that we as a society fail to recognize? And one of them is personality changes, and like being agitated, having social withdrawn, or feeling that the need of having isolation, having poor self-care, and having the feeling and a persistent hopelessness. So we need to stop suicide and able to encourage and our support system in our society, in our family, in our friends, and to reduce our suicide rates. And how are we going to encourage these protective factors? One is to have this effective coping and problem solving skills, and provision of the reason of moving. to our teenagers. So you need to have like a discussion of why you're moving to a new neighborhood, or the reason why you're moving to a new family member, or having the reason of why there's a dog or a cat brought into the house. So that will help them to adjust and able to feel like they are part of the family in decision making. The other thing also is to have that consistency and able to have high quality, both physical and behavioral health care. And this will help us to provide adequate provision of access to care, and reducing the suicide rates. Also, the other thing increases the protective factors is helping them and to feel like they are connected to others. So like um, being able to talk to like to their family member, or even to their sisters, or even to their parents, to their guidance, able to have that trust of having that connection would enable them to have that resilience in their warning signs. And then also to have a support from partners and friends and family. All this will help our teenagers to create resilience and robust inner factors that will help them and enable them to resist or even to consider or even to attempt the suicides. So what are the resources in our community? So one of them that is out there is is to call or text 988, or you can do chat 988lifeline.org, and you can which is available 24 hours a day, 7 days a week. So the teenagers can reach out at any time of the day, and there's always a hope. They should not feel lonely. There's always they should always reach out at any time of the day. And the other resource that they can reach out to is called National Suicide Prevention Lifeline, and that's 1-800-273-8255. And you can call at any time too of the day, and they can help out with the situation where to reduce the suicide rates in our society. The other line that they can reach out to is 804 HOPE, which is 804-4673, 804-4673, and that's the hotline, which is also available 24 hours a day, 7 days a week. So we should, with all this resources, family, friends, our neighborhood, we should help us teenagers feel connected, help them feel that they are at home, and help them feel that they can trust a guardian or parents, so as they can have that open connection and able to reach out in times of need. And when they do reach out at that time, we need also to have availability to our teenagers, make them feel that they are safe, make them feel that they are accepted for who they are, and that they are not alone, and we are here to support them, because the future is bright as a future, as a society, and also as a community as a whole. So I'm hoping that the suicide rates will dramatically reduce in the near future with these efforts being placed in the society. And thank you.